Hi, we're back in the studio with Dr. Jaime Lozada, talking about some interesting things about his lectures, about Loma Linda University and the implant program. Welcome back, Jaime.
Thank you.
I think this was a very exciting presentation. I think it's one of the most difficult presentations you can do because it's a topic that almost everybody does,
Right.
the sinus graft. And as you said, most publications, close to 500,000 videos on the YouTube, and so everybody thinks they know it, but there is some things that is risky and things like that. Maybe can you give us like just a short summary on what we know today that we have to and we didn't know?
Right. I think it's difficult to. You're absolutely right. It's difficult to try to splash something with this topic because it's been done. It's already been done. There's really not a lot that you can say about it. However, sometimes we have to go back to the basics to be successful. I try to point out the aspect of the so-called blind spot, for example.
Yeah.
I have so many questions about that. So what happens if I miss the blind spot? It's an empty area where there is not enough graft.
It's so frequent.
And it's so frequent.
This
and
is
it's
the
so
first
simple.
thing I learned. First thing I learned from you is to go up to the anterior, inferior wall and the quarter.
Exactly. So you have to stay with the wall as close as possible with your osteotomy as close as possible to the anterior wall to minimize the blind spot, precisely.
Yeah. So the blind spot again is the most anterior portion.
The most anterior portion, correct.
I think also like if I would make a conclusion of the presentation, it's very important to understand the functional anatomy of the sinus, the function of the ostium, the different types of anomalies or diseases that you have to manage before, and also the management of complications such as perforations and the postoperative infection.
That's right, and I think those are trends as well. As you know, we published this management of a perforation with a so-called Loma Linda pouch, essentially a technique that repairs the membrane. But I've noticed in some lectures and a couple of publications, slight modifications to the technique that I think I want to do someday, because it makes sense in the way that you can protect the membrane and contain better the graft.
I think it's also important. The sinus is important because it seems easy, but it's a region between dental and the medical field, and like a severe sinusitis, for example, can lead to severe complications.
Absolutely. In fact, you have to rule out all of those patients. That's why when we go over this phase of training with our students, we spend quite a bit of time with church and our faculty there so they understand how to prepare these patients. Rule out any type of pathology that may be present before the procedure gets started. Otherwise, you're begging for problems.
So another topic is the school and the city of Loma Linda.
Yes.
I applied, and thank you very much for accepting me, to the program back in the end of 90s.
Yes.
Because I read about a program, and I read that this was already ranked the best program in the United States. And there were some other programs like in New York and other, but this seemed to be the most comprehensive and the oldest well-established program. So how old is the program and how this whole thing occurred?
All right, so it was founded in 1976 by Bob James. I started the program in 1984 as a student. I was the 5th student of the program. At the time, we used to have one student per year, actually one student every 3 years. Nowadays, we accept 3 students per year for the full-time 3-year program.
Residency.
For the fellowship program, we only accept specialists, and we accept 4 per year, specialists of different areas. There are periodontists, prosthodontists, oral surgeons, and we have even endodontists sometimes. They come to the program as fellows. But we also have other educational opportunities such as the internship and externship. And with the internship, they primarily assist
There's like a
Everything.
preceptorship, right?
It's like a preceptorship. They do everything because they assist. They pick up lunch. They also collect the literature. So
And many times they become the residents.
that's right. I had students that start as an intern, 1 year, 3 years in implant dentistry, and sometimes they even go to another specialty. That's
The 3-year residency, you can still do a master's degree, right?
yes, you do. You can select either the certificate track or the master's track. Most students select the master's track because
which is
they
good
do.
because they
Yeah,
do
of
a
course,
research,
they do
which is
research.
very serious.
That's right.
So it's a very strong certificate. Now, how many are the international compared to the U.S. participants among the residents?
Yeah, I think for the most part we have been traditionally
Very
international.
right? Very international.
But it's interesting, in the last few years,
Changing.
it's changing. More and more nationals.
And I think that's probably because the United States is changing.
That's right.
So more and more comprehensive clinics. I know periodontists who
Right.
hired prosthodontists,
Yeah.
and they don't want to have any referrals anymore. They want to do the whole thing because of the control. And Europe was, and also international was more always like that. So I think, for me, this program is a perfect program for somebody who wants to do it all.
Right.
Because this is all about, the planning, the surgery, the prosthodontics, the lab. So it's very, very comprehensive. So would you recommend that also with somebody like a fresh graduate who's interested in implant dentistry? Do you have right after school, or usually they have some experience?
What we recommend is for them to enroll in the internship program, doing a preceptorship.
To see if they
Just
really
to
like
see
it.
if they really like it. And many of them, they end up liking it, so they can be, they may have a better chance to be accepted because they learn the process.
Everybody knows each
and
other.
everybody knows each other.
And I have to tell you that if you want to apply, and if you're going to go to this program, it's going to be very, very busy.
Yeah, it is.
Still 7 o'clock.
Still
literature
7
review.
o'clock. Still
Okay.
7 o'clock.
And sometimes at midnight you leave the lab. So
you remember.
yeah, but I think that is changing your life. Now, talking about the community.
Sure.
So you said about the blue zones. So this is one of the 5 blue zones. So where people live long, one of the longest in the
Sure.
world. And what I've seen is they live in peace.
That's correct.
And I think that might help. So what do you think, you're there for a very long time. What do you see as these are the most important contributing factors for this?
I think it's the sense of community. If you remember, if I have to point out the fact that in other universities, there was always a constant fighting between who's going to be in charge of implant dentistry in that university. You didn't see that at Loma Linda.
Right.
We were just excellent camaraderie. I mean, I don't remember if I ever got any argument with any of the other program directors over implants, just the opposite. So that sense of camaraderie, it's also health-related issues, exercise, a little
The
bit of the
food.
religion as well too. I mean, of course, with the religion is important too,
Yeah.
for the Seventh-day Adventist side.
Yeah.
So I think that makes a very unique environment.
And if I read it correctly, Loma Linda has one of the best hospitals in the United States for a
Correct.
very small city.
Yes.
And once I read that in Loma Linda, and I think that's what I've seen. The generations, the families, the generations of the family live close to each other, not in
That's
one
right.
house, but close to each other. And if somebody is sick, they go to the hospital, but they take that person back home, and it's not like in a center for
Exactly.
elderly. So they take care of very well each other.
Exactly. That's an important component as well. It's this sense of community and relationships that makes our area unique.
I'm telling you a secret. When I go to Loma Linda, the first thing I go is the supermarket. So I park my car.
Loma Linda Market. Yes.
Loma Linda Market, and I buy some seeds, and I buy some, all kinds of little things. And I many times, and I love that, I meet with couples, married couples, and what I like, they're sometimes very, very old. And what I like is the husband is also alive.
Yeah.
which is great. And I remember once I bought there was like a juice, what you can buy
Yes,
different juices.
juice.
And one was very green, and I did not understand half of what's in there. And I asked, is this good? And the lady smiled at me. She says, it's healthy. And yeah, it was special
Yes,
taste, but very healthy.
That's right. There is one juice that they are starting to become very popular in Loma Linda. It's called the Berry Berry. It's a
Berry
combination
berry.
of
Yeah, yeah.
berries and
That's
and
good.
it's one of my favorites. So I
course.
try to drink that every day.
Yeah, me too, but then I wanted to have something else. So, but in general, if I summarize it, it's more organic food.
Healthy
And
food.
healthy food.
Based in grains. Quite a bit on grains.
Vegetarian,
The vegetarian.
grains,
That's right.
no alcohol, no caffeine,
No
and no
alcohol.
tobacco. And a good community.
Exactly.
Thank you so much for accepting this
Thank you.
invitation.
Thank you,
And we'll be
Istvan.
back later with some more interviews. Thank you.